Good morning, everybody. Somebody could do a quick chat in and make sure that you can hear me. I want to do a quick sound check. Please stick in a chat and then we will get started. Or somebody can just, or you can just say something too. Hold on. Got a couple of, okay. Thank you, Todd. Todd's saying you can hear me. So wonderful. Welcome, everyone, and thanks for joining today. Glad to see that folks are still joining and finding these calls useful. I do have a little bit of information to share, and then I'll call on each of you to check in, and feel free to pass or just send me a text or a chat saying what any updates you have if you're not able to join on the phone for any reason. It's just to start with a quick overview of what's happening nationally. I'm sure most of you are following the news. We're over 150,000 deaths, so this week was kind of a milestone in that regard, and approaching 5 million cases. I think that one thing that's interesting, this is the cases in the last 7 days, so in the last week, which is different than the map I often show, which is total cases, so you'll see some different colors on this. And in the last week, Vermont has had 26 cases in total, Rhode Island has 798 cases, and Minnesota has had 4,144 cases, so that's in the last 7 days. I think that a more telling map is this next one, which is where states are trending. And one of the concerns for Vermont at the moment is that, as you can see, states around us are trending up. Vermont is dropping, though to be fair, our cases are so low that whether they go up or down is it's hard to catch on a graph, because if we have 2 more cases, then all of a sudden we're 100% increase. So, but around us, cases are rising. So you can see on here that New Hampshire and Massachusetts are both going up. And John's commenting there's so many out-of-state plates, and absolutely there are a lot of people in Vermont from out of state, and we can hope that they are following protocol and quarantining and wearing their masks when they are here, but as I'm sure some of them are not. So definitely a concern for Vermont, and I think that's part of the mask mandate that Governor Scott put in place last week, was that concern, was that there are a lot of people coming from out of state. So school opening, I'm sure that is on a lot of folks' minds, and I just wanted to share kind of what we know, which is not a huge amount, but schools are planning to open in Vermont and in Minnesota on September 8th, from what I could find on Minnesota websites. They're also on September 8th, and then Rhode Island on August 31st. Definitely going to affect a lot of us in one way or another. It's going to affect staff work schedules, and of course there's a lot of concern about increased risk of community spread, and how is the opening of schools going to affect community spread. There's a lot of conflicting data around how much children contribute to the spread of COVID, and depending on which studies you look at, they are contributors or not. It also depends on what age children they're talking about. So sometimes in some of the studies, they're saying children do not spread COVID, but they're talking about children under the age of 10. So high school students are different. So there's a lot of conflicting data. Basically, we don't know yet. Many of our participants have school-age children in their homes, whether they're grandchildren that they're caring for, and that's going to become more of an issue with some of the alternating days or half-time schooling that's being proposed, and some of them have full-time children with them at home. So that's definitely going to be a factor. the new study published in the medical journal JAMA found that the school closures back in March led to 1 million fewer COVID-19 cases and saved more than 40,000 lives. So a really big deal. But as we're coming back into school reopening, of course, there's a lot more safety measures in place. So the masking, the social distancing, the plastic being put up, and a lot fewer kids in the classroom. So hopefully this isn't the same kind of scenario that we're talking about here. There's certainly know a lot more than we did in March, and it wasn't possible to put all those safety measures into the schools in March. So optimistic that that's not going to be the case when schools reopen, that we were going to have a huge increase. And the one thing that is really clear is that the risk of school opening really depends on how much community transmission there is at the time when school opens. So if you're in an area like much of Vermont is, where there is very, very low community transmission, then the risk of school opening is, of course, much lower to increase community transmission than if you're in a community with high transmission rates. The Minnesota Department of Health site has some really good information on that and how different school districts should make those decisions based on community transmission rates. So definitely a lot that we're going to be learning over the next couple of months around school and what that does. And I have some questions for you around that in a minute. I did just want to share a webinar that I attended this week that I thought was really helpful. It's an overview of diabetes and diabetes prevention and why that's so important right now. It is put out by COCA, which is Clinical Outreach and Communication Activity through the CDC. And this really troubling statistic that I got out of this webinar was that, of course, we know diabetes increases the risk of severe illness from COVID-19. But the statistic is that 50% of the people who died from COVID-19 who were under 60 had diabetes. And 1/3 of the people who died from COVID who were over 65 had diabetes. So it's a huge factor. And there's as much as we can, and we're doing this work continuously through SASH and trying to help people better manage their diabetes. There's a lot of unknowns as to why COVID is affecting people with diabetes so much worse, whether it has to do with medication, blood sugar, or some other factors. But it's certainly a huge factor, and a lot of our participants potentially are more interested in addressing their diabetes right now because of this. So it's an opportunity to help them. There's a lot of the online diabetes self-management programs, the diabetes prevention programs are being offered online. So that's all through myhealthyvermont.org in Vermont, and then there's the CDC, DPP has a website as well showing where all those online programs are for folks in Minnesota. So this is a great time to be encouraging our participants to join one of those classes. Just a quick update on personal protection. I know I've talked to several of you in the last couple of weeks about the kind of ongoing issues around N95 masks and where to get them and how to get them fit, and I do not have any answers for you at this point. I can tell you that there are still shortages, and my understanding of most of the guidelines is that they are meant for taking care of confirmed or suspected COVID-19 patients. We should not be doing that. That said, for nurses who feel like they are at increased risk, it's still a good idea to have one, and I will certainly share more information as I get it. There is new guidance. Dr. Fauci and the CDC has new guidance out about eye protection, that eye protection is recommended for the general public in areas with moderate to substantial community transmission. Dr. Fauci is saying the general public. The CDC and their infection control guidance for healthcare professionals are suggesting eye protection for areas with moderate to substantial community transmission. And for areas with minimal to no community transmission, it's considered optional. certainly you should all have face shields. They are hot, they are uncomfortable. I wore them this week to see a couple of participants, and I have to say, I thought of all of you who have been using them for months now, because they are not pleasant to use, but definitely a good idea. You should all have them. If you don't, please reach out to your team leader or your implementation manager. They should have them. And Melissa is saying they fog up quickly, and yes, they do. They fog up. You can't see, you can't hear, a participant can't hear you. So I don't feel like we need to be wearing them all the time, but if we can keep our 6-foot distance, have a conversation with the participant, put it on, go in, do the blood pressure or whatever it is that we need to do very close to the person, then back up and take it off. We don't necessarily need to wear it for the whole visit, unless I guess we're doing a half an hour assessment in somebody's small apartment and they aren't wearing a mask, or those kinds of situations you might need to wear it longer. But certainly make sure you have them. Try to find one that fits right and that's comfortable. And this is a great website. The infection control guidance is on. It's the CDC website here. I was trying to find some sort of graph that showed increased risk with distance and time. Obviously, the closer we are to someone, the more we increase our risk. The longer time we are close to someone, the more we increase our risk. So, and also the more transmission there is in our community, and the more people we see on a given day, the more we increase our risk. So there's certainly a lot of factors, and we're having to weigh all of those things. But as much as we can limit, extend distance and limit time, the better. All right, I think this is my last slide for you guys. Checking in about supplies. Do you have yours? Are they working? I have heard from one nurse about a pulse oximeter that wasn't working right, and we're working with her to get that sent back and replaced. So please reach out to me if you have something that's not working. Also, wanted to check in about the thermometer. So we have one thermometer at Cathedral Square that is kind of consistently giving a 97 reading. And everything I have found on various government websites is that the thermometers are supposed to be accurate, the same as an oral thermometer. Or so if you, it'd be interesting to know if your thermometers are seeming accurate to you and how those are working. So you can either chat that in, or you can let me know when you give a report. And then just a quick reminder that the QI project with your selected participants with diabetes and hypertension is due tomorrow, and also that monthly supply tracking sheet is due tomorrow. And if you haven't loaned out any of your equipment yet or not, that's fine. If you could still fill out the form and put in 0, that's helpful, just because this is a baseline month. And so having a bunch of zeros is fine, because then we can show growth over the next several months. So please fill out that form. I've gotten some great comments from the nurses who have filled it out already. I showed some of those comments to the Vermont Department of Health, who gave us the funds to buy those supplies. So that was super, super helpful. I really appreciate that feedback and those comments. And then both of these tools are on the STAR on the Nurse Tools page. So if you can't find that email with those jot form links, those are both on STAR. All right. So questions for you guys. Definitely want to check in around what you're seeing for needs in your participants right now. What are your biggest needs, and thoughts and concerns about school? So anything, and certainly school may not be an issue for some of you, but it's going to be an issue for your panel. So however it's affecting you, I'd love to hear about that. I know that's a topic of conversation right now as we try to figure out how SAS should respond and how we can best support all of you. So let me start with Todd. I'm pretty sure you are on the call, and I think everyone is unmuted. Todd, I think you're self-muted.
Good morning.
Morning, Todd. Go ahead.
The biggest need that I have seen is some kind of outdoor activity. People are very bored. Uh, I did a one PowerPoint presentation at Thayer House out on the porch, and a bunch of people showed up, and it was people really enjoyed that. Uh, I'm frustrated because, for instance, in Colchester at Holy Cross Senior Housing, I donated a cornhole set over there, and people used it at first, but um, now they're not. So I don't know what to do. Any ideas would be appreciated.
Right. Thank you, Todd, and enjoying the birds in your, I don't know if that's outside your house or inside your house, but thank you. Yeah, definitely other folks who are doing any outdoor activities, please chime in about that. I know the coordinator here in Bradford did some socially distant walking with just 2 participants, but I definitely agree that there's a level of boredom which unfortunately is not going to improve as we get into the colder, less pleasant months. Um, so yeah, any ideas you have on that, please chime in. All right. Judy, can you give us an update from Minnesota? I'm not sure, Judy, if
Yeah,
Judy's on the phone.
I think I just
go ahead.
unmuted myself. I think we're kind of in a really different stage than you all are right now. We just, we are at just a couple different sites. There's only 4 of us, and we just opened up for myself and another SASH coordinator to be able to go back to more than one site. So as of last week was the first time we were actually back at more than one site, and things are just really, really slowly starting to open up. So right now our biggest needs is just figuring out our PPE because we really were not having any contact with participants at all. So we are all waiting for goggles and sanitizers and things like that to come to be delivered to our offices. As far as schools reopening, I know that our governor has basically said each school district can decide for themselves how they want to reopen, if they want to stay virtual or if they want to be back actually in the classroom. I don't think many of our actual participants are going to be affected much by school because they're all senior adults, but there's definitely the concern of just the community spread and how that will affect everyone. And I know right now, at least here in the state of Minnesota, people are concerned because the Sturgis South Dakota Bike Rally is starting the end of this week, and they are expecting at least 250,000 people to show up for that. And being that Minneapolis, St. Paul is probably one of the bigger cities. Sturgis is 8 hours away, but any major catastrophes or big outbreaks, we would probably see filtering into Minnesota. So there's just a little concern about that as far as the next 10 days of Sturgis. But again, we're just really, I think, in a different place than you guys, as we still have a lot of, people coming down with it just because we're a bigger state. So we're just slowly but surely moving forward.
Thank you, Judy. Jenna?
Hi, everyone. So we're doing pretty well here. In terms of participants' biggest needs right now, I would say there's, a variety of medical needs, participants needing to get in for appointments, and also just different procedures at this point and trying to get them in this summer rather than waiting till fall or winter. So just a lot of coordinating of care. Actually, quite a few dental appointments and podiatry appointments that have just been put off for a while. And also, I would say just the coping with isolation still. So just giving support in that way. And what are my biggest needs? Well, I still need an N95 mask, even just have one on hand. I know that's not something that, like you had mentioned, Casey, that I'll just be wearing each time, but that would be great to have one that would fit. And also, in terms of the pulse oximeter that's not working, if, once I receive an email, when you let me know just how to, send that back, I will definitely do that. But all the other equipment seems to work, and I will do those drop forms and send that in, but I've heard really good feedback so far from participants, using, self-measuring their blood pressure, also using the pulse oximeter. So that's going well. And concerns about school reopening, not, I guess just regular concerns, and also just with, the possibility of more community spread, but no other real concerns in that regard. But yeah, we're doing pretty well here. We've not had any COVID-19 positive cases on our panels, so that's been good. And yeah, that's about all I have today.
Thanks, Jenna. And I know Joanne is going to reach out to you about the pulse ox.
Okay, great.
Thanks for bringing that up.
Thank you.
Bonnie, I know you're brand new, but you want to give us a quick update on how things are going?
Well, things are going good so far. I'm still in training. I haven't done any assessments or gone out to visit anybody yet. So I did get an email from Melissa about another Melissa Stockholm that I'm going to reach out today to hopefully connect with her and get some more information that I need about visiting participants. So that's kind of where I'm at.
Right, and you're covering, you have 4 panels?
I have 3
Right?
panels. Yes, Northern Vermont.
Right. All right, thanks, Bonnie. And I think Melissa Stockholm is on this call too, so she's hearing you.
Oh, great. Well, you'll be getting an email from me today. Thank you.
Thanks, Bonnie. Kate's also a brand new wellness nurse. Kate, you want to introduce yourself and let us know how things are going there so far? I think you're still muted, Kate. Unmute.
How's that?
That's it. There you go.
Sorry.
Okay.
Things are going. Yeah, I'm kind of in the same boat as Bonnie. Still orienting. I'm doing the section 3 with Amy today, and still just sort of feeling things out. It's yeah, it's interesting because I guess I've never had a job where I'm like learning everything at home on my own, obviously not all on my own, but it's just a different way to learn as a nurse, right?
Absolutely. Yeah. And where are you, Kate?
Oh, I'm sorry. So I'll be in Waitsfield and Waterbury. And it's a 50 participant panel with Ken Russell, who's the coordinator.
Great. And have you met anybody yet, or?
I haven't. Yeah, just still. I need to get supplies from home health. And that'll be next week when I go over there for CPR training and things like that. And I still need a laptop to work on. I've been using my personal one, so those are just little like logistical things I'm still having to figure out. Luckily, I know some of the participants because of my previous job. So I think, that kind of helps, that I'll be able to get back in with some of those participants and, remind them who I am.
Great, wonderful. And please reach out to other SASH nurses, to myself. I know you have a great team of nurses there in that area, all working with Kenneth. So please reach out and ask questions, because you don't need to do it all on your own, and it doesn't necessarily all make sense until you can get some context around from other nurses and how they do things.
Yeah, in fact, is it Melissa Roy? I actually had a phone call with her yesterday, and she was great. So I was curious about, traditionally, do new SASH nurses kind of have a shadow day to be with another nurse? And do you even think that that's possible now? Just because I think it's a great way to kind of see how another nurse operates and does their work.
Yeah, absolutely. Traditionally, the shadow days have been really successful and really helpful for a lot of nurses. I guess it would kind of depend on how things, what phase your panel and your area is in, so that I would definitely suggest talking with Kenneth about that, or with Melissa,
Okay.
if she's comfortable having you come there for a day.
Mm-hmm.
Especially right now, it's even more important. It's also certainly more challenging to figure out all the logistics of that. But even if you could see her do one assessment,
right.
I know when I was orienting a new nurse recently, we did some phone. At that point, we weren't doing in-person visits; we were doing only phone visits. But we did some joint phone calls. We did the assessment over the phone together, just so she could hear how we do it.
Okay.
So that's another option too.
And then even for blood pressure clinics, to see, just how those are operated in some other location. I'd be willing to travel to kind of just make sure, when I start my own, that I'm doing that correctly, I guess.
Yeah, absolutely. And a lot of those are being done outside right now. So you could watch from a distance.
Sure.
That would be great. So yeah, I would definitely advocate for that, both with Kenneth and Melissa.
Okay, thank you.
Thanks, Kate. Welcome. Kathy. You're muted, Kathy. Kathy Schuster.
Okay, can you hear me?
We can. Go ahead, Kathy.
So basically, as far as participant biggest needs, I'm still hearing their isolation and still feeling they have to really have very, limited social contacts. And I think that is huge. I'm out in a remote rural area for the folks in the West River Valley, and they already are kind of hunkered down anyways in their pre-COVID, it's a very rural area. So I think that's been really hard. And, in talking to someone recently, it's also hearing the day-to-day conflicts in our world amongst, politics and guidance. And I think that can be wearying, even in their own families. So I think just being a sounding board and being able to take the time to listen, I think that's been a big piece, is truly still the isolation right now. as far as my needs here, I think, we're okay. I've been talking to my coordinator, and I think a big piece we've talked about this recently is we miss seeing each other. We can't be in the same space together due to the logistics. So that's a big deal, because we can go weeks, we've been weeks without even seeing each other face to face. So I think that's been a big shift. And we've talked about that a bit. As far as concerns about school, how school reopening, I work in another area outside of this where I am in a clinic setting, and I work on a grant now for families and children. And it's come up that I might be having to do some engagement as school reopens around wellness, preventive, with in a clinical setting. So things are pretty tight due to the fact it's in a clinic with clinical guidelines. So that could be a change if I am in a setting going forward where I may be seeing kids, going down the road. So that could change things for me. I don't know that yet. So I think that's it.
Thank you, Kathy. And I agree that not being able to just chat with your SASH coordinator face to face you do feel very isolated. It's not the same to be just emailing back and forth or texting, or definitely not the same. I think that is everybody. But please chat in or shout out if I missed you, or if you have other things to add. I am just to explore this idea around schools a little further. One of the things I'm curious about is if you guys think that SASH should respond in any way when schools reopen. Should we back off? Should we just not see participants who we know have high exposure to a lot of children, whether they're grandparents who do childcare or that kind of thing? And what about staff who have kids in school? I know that I'm sending my 2 kids to 2 different schools with 2 different schedules. It's not going to particularly affect my working because I'm mostly working from home, but I'm sure that there are other staff who are going to it's going to be challenging to just go to work because they have kids at home again, when they were maybe hoping they would be back in school. And also affecting our risk. So as we go and see participants, what risk is there that we are carrying the virus because of our exposure to school-age children? So just, you can either unmute and chat in, or you can either unmute and talk or chat in if you have thoughts on that. That's just something we've really started talking about as an admin team. We were hoping to bring it up on Monday on the COVID call and see. I think it may affect SASH coordinators more than nurses since we have such limited hours. But
It's definitely a concern for me. This is Kate, because I have 2 young kids and they're possibly going to be on different days in different schools. So I still don't really have childcare. Not that school is childcare, but you know what I mean. It's my daughter might be in school only 1 day a week, and then my preschooler Monday, Wednesday, Friday. So it's like it's challenging, and I'm just not sure how to navigate. How do I even come up with a schedule that's consistent right now until I know more of how that's going to work for my family?
yeah, absolutely, Kate. Thanks for sharing that, because that's what we've heard from other staff as well. I know that the big key, both for us and for all the administrators, is going to be flexibility and being as flexible. SASH has historically been a very flexible program. This is going to require even more flexibility, I think, on the part of everyone to make this work.
And I really appreciate that. I really I'm blown away by that, and it's really nice to know, and it certainly eases my mind, but you know, you still need to have some sort of schedule to know, okay, I'm working during these hours. So
Yes, yes, it's going to be a challenging couple of months, and I know different employers are everyone's going to handle it differently. At Cathedral Square, they have a committee put together for Cathedral Square employees just to try to brainstorm how can we help people. So they haven't really come up with any solutions yet, but starting the conversations I think is really, really important. So if those conversations aren't happening yet with your employer, with your team, I think we should start having them, or start initiating them, and we'll certainly share anything that we come up with as far as best practices. I know there's some talk around, you know, what an additional challenge of childcare is then you're adding a new group of potential germs. So when you say, well, we'll come up with an alternative childcare situation for the other 3 days, then your kid is getting a different set of exposures than they are at school, or potentially that's a different germ pool that they're bringing home, increasing your risk. So there's all kinds of factors, just like with everything with COVID, that's going to affect this. Anyone else have any thoughts or comments? And anybody else have anything else they want to bring up? That was everything I have, and I'm certainly happy to give you some time back. But if there are other things people would like to talk about, please bring that up. Okay, I'm going to give you all back 20 minutes into your day. And thank you so much for joining. And I hope you can make the COVID call on Monday. Have a good rest of your week, everybody.